Feeding tubes. Feeding tubes are plastic tubes that are made out of polyurethane or silicone, and they supply nutrients to people who are malnourished or can't eat for whatever reason. When they are nasally placed, they're called nasojejunal or nasogastric, depending on where the tube ends in the body. Nasally placed tubes are usually placed in for less than 4 to 6 weeks, and going through the stomach, they're for more than 4 to 6 weeks. They're important because they're used to deliver nutrients, and people need those to survive. It's most often used towards the end of life, and they're not recommended for dementia patients because they'll forget to clean their tube or use it properly. In certain medical conditions, people will need to use them to eat. Insurance will typically cover it if it's used 100% of the time, and if not, prices range from $2,000 to $4,000 depending on the placement and how long you need it for. There are risks associated with having a feeding tube, such as clogging, infection where the tube is inserted, diarrhea from having an all-liquid diet, leaking, and just overall pain. Timing varies by person. Sometimes people will have them in for the rest of their life after a surgery or injury, and sometimes people only need them for 1 to 2 months, a few weeks. Older cultures infused nutrient solutions to treat bowel disorders, but actually surgically placing tubes only began in the 1800s. First few attempts were disastrous, but they improved, and as techniques were being developed, different scientific discoveries were being made. And with a personal anecdote, it is said that the feeding tube tickled the nose, and it stopped in the back of the throat, and you could feel it every time that medicine was being taken, and it was in for about 2 months.